Hello everyone, I'm Prachi and welcome to my channel Easy Nursing. In this video I'm going to talk about IUCD intrauterine contraceptive devices. An intrauterine device, IUD, also known as intrauterine contraceptive device or coil, is a small, often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. There are two types of intrauterine contraceptive devices. They are medicated and non-medicated. Both are usually made of polyethylene or other polymers. The medicated IUCD release either copper or progestogens. The non-medicated or inert IUCD are often referred to as first-generation IUCD. The copper IUCD comprise the second generation and the hormone-releasing IUCD the third generation IUCD. The first-generation IUCD comprise the inert or non-medicated devices, usually made of polyethylene or other polymers. They appeared in different shapes and sizes: loop, coil, spiral, ring, and bow. Of all the models, the Lips Loop is the best known and commonly used device in the developing countries. Lips Loop is double S-shaped device made of polyethylene, a plastic material that is non-toxic, non-medicated, non-tissue reactive and extremely durable. It contains a small amount of barium sulfate to allow X-ray observation. Second generation IUCD, new approach was tried in 1970 by adding copper to the IUD. It was found that metallic copper had a strong anti-fertility effect. The addition of copper has made it possible to develop smaller devices which are easier to fit, even in nulliparous women. A number of copper bearings devices are now commercially available. The earlier devices are copper 7 and copper T200. Newer devices are Nova T, copper T380A, copper T220C. The advantages are low expulsion rate, lower incidence of side effects, easier to fit even in nulliparous women, better tolerate by nullipara, increase contraceptive effectiveness, effective as post-coital contraceptives if inserted within 3 to 5 days of unprotected intercourse. Third generation of IUCD releases hormone. The most widely used hormonal device is Progestacert, which is a T-shaped device filled with 38 mg of progesterone, which is a natural hormone. Another hormonal device is LNG20 or Mirena, a T-shaped IUCD releasing 20 mcg of levonorgestrel, which is a potent synthetic steroid. It has a less number of ectopic pregnancies and low pregnancy rate. Mode of action: there is a non-specific inflammatory reaction along with biochemical changes in the endometrium which have got gametotoxic and spermicidal property. Lysosomal disintegration from the macrophages attached to the device liberates prostaglandins, which are toxic to spermatozoa. Macrophages cause phagocytosis of spermatozoa. Contraindications are suspected pregnancy, pelvic inflammatory disease, vaginal bleeding of undiagnosed etiology, cancer or tumor of pelvic organ, previous ectopic pregnancy, anemia, menorrhagia, purulent cervical discharge, fibroids, trophoblastic disease. The ideal IUCD candidates are who has borne at least one child, has no history of pelvic disease, has normal menstrual periods, who is in a monogamous relationship. Timing of insertion: although the loop can be inserted at almost any time during a woman's reproductive years, except during pregnancy, the most propitious time for loop insertion is during menstruation or within 10 days of beginning of a menstrual period. During this period, insertion is easy because the diameter of the cervical canal is greater at this time than during the secretory phase. Advantages are no complex procedures are involved in insertion, no hospitalization is required, procedure takes only few minutes. Once inserted, IUCD stays in place as long as required. Inexpensive contraceptive effect is reversible by removal of IUCD. Side effects or complications are heavy bleeding, pain, pelvic infection, uterine perforation, ectopic pregnancy, expulsion, cancer, mortality. Follow-up: the women should regularly check the tail of IUCD to be sure that the IUCD is in the uterus. If she fails to locate the tail or threads, she must consult her doctor. She should visit the clinic whenever she experiences any side effects such as fever, pelvic pain, and bleeding. If she missed a period, she must consult a doctor.